of our webinar series on the school reentry guidelines. The topic of today's webinar is trauma-engaged practices. And I just want to remind you before we start that after today's webinar, we have 3 more webinars coming out to round out our series. The next one in 2 weeks on September 30th will be focused on career readiness. It's actually going to be solely based on the K-12 guidance plan and any questions that you might have regarding implementing that as we start a new school year. So you want to make sure you join for that one. And then on October 14th, we're going to be focusing on reentry into schools through a rural lens. And then our final webinar will be on October 28th, focused on an urban lens. As a reminder, all of our webinars run from 3 to 4 o'clock in the afternoon. And if you would like to register for any of these webinars, please visit our website, paschoolcounselor.org/reentry. The other thing I wanted to remind all of you about is the reentry guide that these webinars are based on. You can see it there on your screen. You will also be able to find this at paschoolcounselor.org/reentry. We are very happy today to have representatives from both PSCA and ASPP that collaborated to put this companion guide together for us. Today's objectives, we're going to do an overview of COVID and trauma-related responses to it. We're going to talk about school-based professional mental health collaborations, specifically collaborating between school counselors and school psychologists. We're going to be touching on the statewide plan for healing and preventing trauma, as well as the statewide suicide prevention plan. And speaking of that, I just want to remind everyone that this month is Suicide Prevention Month. And we just want to continue to lend support to all of those who might be affected by suicide, whether they're students, families, or staff. The next objective that we plan to go over is the COVID-19 School Adjustment Risk Matrix, and then also postvention. Our presenters for today are Drs. Titina Brown, she's a school psychologist at Lancaster Lebanon Intermediate Unit 13. And through recording, we will have Dr. Erbacher, she's a clinical associate professor at the Philadelphia College of Osteopathic Medicine. And then finally, last but not least, our president of PSCA, Mr. Steve Sharp, who is a practicing school counselor as well as a nationally certified school suicide prevention specialist. So we are all happy to have you here today. And if you would like to start with any of those objectives, I'm not sure where you want to start, but I'm going to turn it over to both of you. So thank you for being with us today.
I'm just going to take the lead, and really I'm going to thank you, Tina, for joining us and really for all the work that ASP has been doing, particularly when it comes to school reentry and supporting students. You guys have been doing a big ASP job on it, and we appreciate everything that you've done so far. I'm really excited that you could be with us here today.
Thank you so much, and thank you for inviting us and just the continued collaboration, because we know that when we work together, it just benefits our families, our students, and our staff.
Yeah. So getting started, I mean, we really have a central question that's been present in our minds since March. It really is, how is COVID and the pandemic related experiences when it comes to racial justice and racial trauma that we see on our TVs and presence in our communities? How is this impacting our students when it comes to their trauma-related experiences? And I think that's a salient conversation. When we really look at it and take time to really unpack it, we understand that Pennsylvania has been taking initiative for this. Since 2019, Pennsylvania has pushed for a school-wide approach when it comes to trauma engagement to support all of our students. And that's through areas as far as safety, building trustworthiness through transparency when it comes to school communication, developing pathways for peer support, collaboration, and mutuality when it comes to family and community engagement, empowering the voices of those with lived experiences, and then in addition to that, really recognizing both the cultural and historical presence of traumas and the gender issues that can come out of that as well, to make sure that we can support all of our students and the whole students. When we start talking about these things, I think it's really central that we take time to understand different ways that we can support students. We understand as far as just basic evidence-based and best practice, let alone with what could be a range of experiences, we need to really look to our multi-tier system. The reality is that universally, we've all gone through a collective experience and our students may have gone through, to a certain extent, a collective trauma or ongoing compounded traumas. And so really these multi-tiered approaches would be our best way that we're able to identify and support our students moving forward. Tina, can you talk to me as far as just like multi-tiered approaches when it comes to supporting students?
Sure. And I think many of us got used to talking about MTSS in a certain way prior to COVID, certainly with academics and even with some social emotional learning. COVID kind of upended many of the things that we were trying to do with students. And I was constantly impressed by professionals' flexibility, school counselors, school psychologists, and others just really still trying to reach out and meet students where they are and provide those continued supports. One great example can be found really in the trauma school-wide approach. It's in the PA plan. ASP has its on its site as well as PSCA. So really it's taking that pyramid and thinking about, okay, how do students' needs change now that COVID has happened? We have students' supports prior to COVID and their experiences with school prior to COVID, but now we have to think about, okay, is the student now? And there's several resources out there to help us decide where we are in the pyramid. And those can be found on NASP's website. We also have some things that I believe Steve's going to share through the webinar and on the PSCA website. But we're looking particularly at the SARM, which is how do we determine where students are based on that pyramid. I don't know, Steve, if you have access to that to show it, or if it's just something you're going to put in the chat later. But it does a really nice job of using some color coding to show us, okay, students who were severely at risk before are, of course, still severely at risk. But we have these kids that are in the middle, that perhaps they weren't our most at-risk students, but they still fall within kind of our tier 2 of student needs. And it's working as a team to determine how do we supply those supports. Some of us are in hybrid, some of us are in person, and some of us are completely virtual. So what supports are out there to still complete that tier and make sure we're meeting students where they are?
Yeah. And then I think just skipping ahead, one place that we can talk about as far as recognizing those things, we had talked about the COVID reentry matrix, which had been developed by NASP. I'm going to take a second to drop it in because we highlighted this in the chat before, in previous conversations. I can pull it up for you too. So when we talk about like the reentry matrix, I want to talk about it through the lens of really two separate areas. The first one is talking about the students' pre-COVID experience. And when we talk about their pre-COVID experience, I'm going to steal the screen for a second. When we talk about students' pre-COVID experience, what we're talking about is their school experience. For some students, they may have a positive experience. They come to school and school might be a break for them. They get to socialize with their students, generally other students. Academically, they're successful. For some of our students, it might be variable. It might be mixed. Maybe they're a good academic student, but they have strained peer relationships. Maybe they've been victims of bullying. And then for some of the students, it's been a difficult experience. It's been kind of negative. They've had ongoing negative peer interactions. Perhaps they've also had some negative adult interactions. Perhaps for some, they're having a student with a disability and they're having trouble, again, engaging in the academic work and don't have the appropriate supports to help them to thrive. And so this is a way of understanding a student's experiences really before March 15th. And then separate to that is the student's shelter-in-place experience. And we understand our students have found a range of experiences. We've all had a student that's frankly, they've thrived during stay-at-home orders. They've done very well online. They've enjoyed the time to sleep in and increase their Fortnite game-itude. And then we've had students that the reality is they've had a variable experience. Perhaps they've had a loved one that's gotten ill during the experience. Perhaps they've struggled with illness themselves. Maybe it's the ongoing anxiety or watching from a distance some of these traumatic experiences have unfolded on TV, or maybe they've had some sort of economic loss as well. And then some of our students have had a distinct negative experience. We know that we have students in the walls of our schools, whether in person or virtually, and they've had loved ones who have passed away, that they've maybe lost their home due to loss of employment. What we do is we measure the students' lived experience from pre-COVID and during the stay-at-home orders. And then this is able for us to understand a student's potential risk when it comes to reentry, as far as having a positive and negative experience from there. And this can be one valuable resource to help to guide our decision-making, to plug students into some of these multi-tiered networks. Some other things that we can do to support students as far as identifying them through these universal approaches could be something like just universal questionnaires. In addition to that, I know that ASPP provide resources. In addition to that, mental health screenings, universal screenings for behavioral health, or universal screens for behavior are some practices that have been recommended in the past by other parties. And in addition to that, just our direct engagement and observation of families, engaging those in conversation through surveys, just as far as their experience. These can be also powerful data tools as well, as we plug our students into things like mentorship or small groups as well.
And I do think, Steve, you make a good point when we think about how students have been impacted. I primarily work with teenagers 16 to 21. Many of our students come to our vocational center. And unfortunately, with that, sometimes is a financial burden because they need tools, they need uniforms, they need equipment. And really kind of thinking about maybe this student didn't have that need beforehand, but really just reassessing how did COVID change that for that family? Is there now a financial need that was there that was not before? How does this impact the students' continued growth in their career, in their chosen field? So all of those things I think are important to take into consideration with reentry. And also just thinking about reentry as this ongoing process. I know that many of you online are from various places across the state. I know here locally in Lancaster County, we've had some schools that have had to close for a week. Brief periods because of exposure to COVID. So students have re-entered, then there was some exposure risk, schools shut down, now they'll be re-entering again. And so how does this constant state of school attendance, lack of attendance, school re-entry, how does that continuously impact our students and their families? These are all things that as a team, and you know, again, that whole idea of self-care with reentry is so important. And Dr. Erbacher will speak to that in the video, that when we think about our constant need as helpers to be on guard for our students during this whole reentry process, there's also that self-care that we need to take attention to.
Tina, you talked about the teaming process. I've appreciated working with you really before this type of conversation, our previous professional relationships, is just that school psychologist, school counselorship collaboration. What are some ways that we can really enhance that collaboration as we support students?
I've been really fortunate that as we work with teams, and as an IU, we work with teams across the county. So I've been very fortunate that I actually think COVID has taught us that we can do virtual meetings really well. And that if that was not in our comfort zone before, we've had to kind of stretch and figure out how to make that work. But in some ways, that actually can benefit some of our families. And so talking to our social workers, our counselors, making sure we're having those team meetings, realizing we don't all have to be in the same place, that if something important comes up that we need to address as a team, we can now make it happen. And I do think that we've all become a little more comfortable with that virtual format and that virtual collaboration. And that really that's to the benefit, not just to us professionally, but to the students we serve.
And any chance that we have to collaborate, what we understand really from lessons learned from Katrina and the reentry is the alignment of practice, the coordination of services. That's really where we're going to get the most payout in our investment when it comes to really supporting students for what, as Tina had referenced before, is going to be not just crossing the thresholds of doors, either in person or virtually, but an ongoing cycle of recovery as we move forward. So again, relying each individual's practice and their lens to take multiple perspectives on how to provide real supports for students. We understand there's a real crisis that's going to be coming, that many of our students, through learning loss alone, might be falsely identified for a disability. And so a chance to collaborate and to brainstorm together, to pull resources together, support students as we enhance their skills and fill in some of those gaps, it can help them to not get unnecessary services that they wouldn't need to.
And I think as a school psychologist, just that constant open communication, school counselors, you guys tend to have much more of the family history, the long-term relationship with the families. And so when a referral does come to us as a school psychologist, making sure that, and you'll see this on NASP and ASP's website, we really do talk about that collaboration. It's one of our big domains. And that includes making sure that we're reaching out to the people that have the long-term relationships with the family. That's more important now than ever during COVID, because as you said, we could have students who come in with increased or new needs based on these school closures. That does not necessarily mean that they're a student who should automatically be identified as a student with a disability, or that they actually need to jump through that whole multi-tiered process and even go to testing. What can we do to continuously build our toolkit so that we can meet students' needs prior to thinking about, does the student need to be identified? And one of the things, before I forget, I want to make sure I mention is pbis.org has some great resources on their website. One of the things they have is guidance on check-in and check-out virtually, and how to do that. During the shutdown, myself and some of our support team members made sure to really think about how we were going to deliver those services virtually. And we found that for our students, particularly the students we serve that were in some of our life skills programs, it was harder for them to reach out to peers to stay connected. You know, I have a pretty neurotypical 16 and 12-year-old, and they were online with their friends. They were able to participate in online teaching. They didn't have some of the barriers that some of our students do. And it was really important that we as professionals keep that in mind and work on how can we connect some of our students to each other in appropriate ways online. How does that help? Where does that fit into the tier of maybe where their social emotional learning is?
So as we're looking forward, one thing that we really want to highlight, as we've been trying to do through our continued practice through the companion guide, is to highlight some of the best resources and the best information out there, whether it be through our national organizations like NASP and ASCA, or through the state itself. So one thing that we really wanted to highlight that have come out over the past few months is that the Pennsylvania new trauma plan, which I'm going to drop into the chat now. I realize I've been very effective in chatting to the panelists, but not to the rest of the attendees, so I will catch up with that in a moment. There were questions as far as the KICO, the check-in, check-out program, and that's pbis.org, which is going in the chat right now. But going to the Pennsylvania Trauma Plan really has six distinct goals that we want to highlight. Ensuring that Pennsylvania is a state culture that is trauma-informed through universal training. Ensuring that all state agencies and policies and practices are trauma-informed. That includes us as schools, and more focused on prevention and healing. And that's something that really, I think, our work as school-based mental health professionals, that we really have a chance to take lead in. Mandate that all licensed and funded entities become trauma-informed, again, us, and building and supporting grassroots community-based efforts to become trauma-informed in every part of the Commonwealth. What we understand is the more support we have in equipping the language and tools to be trauma-informed, to be trauma-engaged, that's when we can get the supports and services to people more readily and also reduce stigma as well. Mandate that all licensed and funded entities become trauma-informed, recognizing and healing the traumas of major life crises like COVID-19, and then finally preventing and healing racial, communal, and historical traumas whenever there be individual or systemic. This is very unique in the language that we hear coming from a state entity, recognizing both systemic trauma and systemic oppression and its lasting process of it, which made it unique when Pennsylvania did put out their 6-goal plan when it came to suicide prevention, now during Suicide Prevention Month. This released just last week. The statewide plan includes a goal to reduce stigma and promote safety and help seeking and wellness by increasing suicide awareness and prevention education. This is central since Act 71 as far as the work that we do as for school counselors in providing sometimes classroom lessons and education when it comes to coping skills, stress management, suicide awareness, stigma reduction, and access to care. In addition to that, we also want to, as a second goal, promote trauma-informed approaches to support all Pennsylvania residents as part of our suicide prevention efforts by coordinating with Pennsylvania's Trauma-Informed Care Task Force. The reality is there's great work being done through Pennsylvania's Care Task Force. Shout out to Dan German out there. As we understand, the work is continuing to grow and more resources are going to be available for schools and practitioners to support people and their lived experience. To provide quality training on prevention of suicide, management of suicide risk, in multiple sectors and settings. In addition to that, promote screening and identifying individuals at risk for suicide across sectors, including healthcare, behavioral health, education, and correctional settings. And so this has been some of the work that I know that I have specifically been piloting on behalf of the state of Pennsylvania. And we're going to look to have more opportunities for people to engage in those conversations on what are the best practices and how you can intervene if you are screening. And then in addition to that, to promote and implement effective clinical and professional practices for assessing and treating those identified as at risk for suicide behaviors, providing trauma-informed care and support individuals affected by suicide death and attempt to promote healing, promote safety among individuals with suicide risk, including firearm safety, awareness, and relationships between opioids and other substances that increase suicide risk, and finally, to improve the capacity to utilize data reporting relevant to suicide, improving the ability to collect, analyze, and use that informed in a timely manner so that we can further prevent suicides. There's a robust work, but central to that is we understand our work as our school-based mental health professionals. We provide the education, we provide the access to care, and this is through both a trauma-engaged lens that can promote healing all the way to suicide prevention. With that being said, we're going to take the next part of our program to watch this video provided by Terri Erbacher, and then after that, we'll unpack it at the end. So please continue to stay tuned. I'm pulling it up. I'm doing casual conversation and a smile. I am going to share my screen, and then we're going to go.
Hey everyone, good morning. Welcome to Suicide Prevention Month. My name is Dr. Terri Erbacher, and I'm a school psychologist, been in the field for over really believe in this work. I'm sorry I could not join you all in person, but I'm happy to have been able to at least record this and get the messages out, as I know we all want to work together to save the lives of the kids with whom we work. Sharing my screen, today we are going to talk about suicide risk amidst COVID-19. There's a lot of risk factors and warning signs for suicide already that we're not getting into today. But we're going to talk about how these relate to COVID-19, as well as some inequities going on nationally at the present time. As always, we just give our conflict of interest statements, and some of the information I will be giving you is from our book, Suicide in Schools, which we published in 2015, and I'm very proud of. I do have a lot of the resources from our book right on my website, erbacherconsulting.com, for free if you want to check them out. What are we going to talk about today? In about 20 minutes or less. There's so much more I certainly could talk about, but we are going to talk about some risk factors with COVID-19 as it relates to suicide. We'll also talk about some racial inequities that might impact suicide risk during this time of COVID-19. We're going to talk about some questions that we can ask kids that we're working with related to the pandemic, related to inequity. But always, we have to make sure we engage in self-care during the pandemic, when we're talking about racial inequity, when we're talking to kids about suicide risk. It's such an important thing that I think many of us are the worst at. We don't practice what we preach, and I really am a believer that we need to. First, just a fact about suicide risk, that 20% of us will have a suicide loss within our immediate family. 60% of us will know somebody and 25% of psychologists and mental health professionals will lose a patient or client to suicide. So this is real stuff. I will tell you that I am in this field because I did lose my own father to suicide in 2001. So doing these presentations for me is a gift, because if we can all work together to save a life, then, you know, this work is worth it. But it really does come from a personal place for me. The bottom of that slide, 50% of patients who die are in treatment. And that's so important to me because, you know, certainly from the school perspective, we talk about getting help for our students and getting them in counseling, but realizing that many are. And what Dr. David Rugg found is that when patients die and they are in therapy, it's usually because there's a problem in the relationship with the therapist. And as school people, I think that's what we really focus on as well, are those relationships. And this just really exhibits how important it is. But speaking of relationships, I think that we are so kind to those around us, especially during this pandemic. We're working on giving grace to our teachers. You know, this is new for all of us. I think most of us have never lived through a pandemic such as this. But the same grace we give to somebody else, we also need to give to ourselves. So whatever you would say to someone else, if they came to you with a problem or, oh, I messed this up, I didn't do it as well as I could have, what would you say to that person? And that's what you need to say to yourself as well. And we really need to have that same grace. We need to give ourselves these same affirmations. This one says about distance learning, but through this whole pandemic, please be kind to yourself, especially when we're talking about suicide risk. I do want to talk briefly about suicide risk prior to COVID-19 and just a few trends. For example, if we look at ages 10 to 24, over the last 2 decades, we've gone from 7, that's per population, right? So per 100,000 people, that's our rate, and to 10 as our rate. And that is huge. These are our youth, our 10 to 24-year-olds. Suicides do occur before age 10. The data is limited through the CDC because the numbers are not statistically significant enough to do a lot of analysis, but they certainly do exist, and we really need to be cautious of that. Suicide risk is the 3rd leading cause of death for 10 to 14-year-olds, and the 2nd leading cause of death for 15 to 24-year-olds, actually for 15 to 34-year-olds, only beat by unintentional injury and homicide. And so we really have to be cautious about for 10 to 14-year-olds, I'm sorry, it's beat by unintentional injury and homicide, but it is the 2nd leading cause of death for 15 to 24-year-olds. Again, this is pre-pandemic. We're getting more information with the pandemic. New data is coming out all the time. But the crisis text line, we often say, text to help to 741 741. Their initial research, again, pre-pandemic, said that while 3 to 5% of the US population identifies as LGBTQ, nearly half of their texters identify that way. So what that shows us is being LGBTQ equals high suicide risk. Interestingly, a lot of the conversations focus mostly on family, depression, and suicide. There's heightened talk of bullying, school, and emotional abuse. But most of these texters are not actually calling about issues related to their gender and sexual identity. A little bit more about social media, because our kids are home during the pandemic, but this is research from before the pandemic. What they found is that we know sleep deprivation can lead, allergies, I'm drinking here, can lead to higher suicide risk. And with social media, because kids have a fear of missing out, they will sleep with their phones next to them. They will wake up with all of those alerts. I keep my phone in a whole different level of my house because I feel like it's so important to not have it with me. So we know that teens also are comparing themselves to others, that we see what appears to be a glamorous life of the others. And it really just creates self-doubt, lowered self-esteem. University of Pennsylvania did a study that showed that social media use is indeed linked with increased feelings of depression and loneliness, and it's exacerbated for those who are already depressed. So if you already have those feelings, the recommendation is get off or limit social media because it can exacerbate those feelings. We also know the research shows that in small doses, social media actually does have some benefits, right? It does make us feel connected, but that's 1 or 2 hours a day. And the fear during the pandemic is that our youth might be on it significantly more, and the harmful effects are more significant for girls, even more so than for our boys. We always tell parents, monitor your teen's social media, see what's going on. But they are so good at hiding what they're doing. There's apps out there to hide their photos that might be inappropriate, but they're also disguising their online behavior with code words. For example, they use #Sue, which is related to suicide. Now, Instagram, all of the social media sites are doing the best they can to catch these. And if you can see on the screen, when I typed in #Sue, Instagram did have a pop-up come up that said, "Can we help?" Posts with words or tags you're searching for often encourage behavior that can cause harm or even lead to death. If you're going through something difficult, we'd like to help. You can click on Learn More for some resources, which is wonderful that our social media sites are doing everything they can. And there are some positive ones that kids are searching, right? Like the You Matter movement and a lot of positive quotes. There's suicide prevention in social media, SPSM, that kids are looking up. Here's just some examples of some of these hashtags that kids are using that maybe you're not familiar with, maybe our parents aren't familiar with. We need to get the message out there, UC Dallas as an example, and their, parents, rightly so, may think it's a peer, a friend, but really look at these. It's so important to see how kids might be hiding what they're actually looking at.
I have to apologize. We are running short on time. What we're going to do is we're going to speed up to slide 21, which gets into some more in-depth content. And then we'll post this along with the full recording onto the website, along with some other resources that we have ready and available for you. So if you could please just hold on for a second. Apologies for the interruption.
And I think just for the audience knowledge, I think it's important to talk with your teachers, those that may be hybrid, those that may have some online students. Give them this resource. Let them know here are some things you can look for. I know that when we had our students on like their Google Classroom, and we have some algorithms that search for things that might be questionable or things that might be of concern, and then that gets forwarded to one of the support team members, and we check in with that student directly. And so just sharing this with your teachers can be immensely helpful, particularly for districts that are either completely shut down or have some sort of partial shutdown, and teachers have to continue to teach online.
So why don't we begin again, just as first COVID and mental health, starting now. Thank you.
Research done by the Kaiser Family Foundation. What they found is that 72% of Americans say their lives have been disrupted, a lot or some, by COVID. And you can see the breakdown by male, female, Black adults, white adults, and parents and non-parents. And it is concerning. Again, mental health research that we have with our adults, this impacts our kids too. We don't always get the research first with our youth. But it's, anything impacting our parents. And certainly if there's a suicide loss of a parent, that absolutely is going to impact their children. Again, the Kaiser research showed that Americans are worried about the long term of COVID on their financial security. They're either worried about losing a job, losing income, or they've already lost a job or income, 39%. Americans are afraid of getting sick or getting their family members sick because maybe they can't afford to stay home. And we're going to talk a little bit more about that with the CDC research and the inequity there. 45% of adults report that the stress due to COVID is harming their mental health. 1 in 5 say it's had a major impact on their mental health, including 1/4 of women, 24% of Hispanic adults, and 24% of Black adults. Other research with COVID-19 and suicide risk. The PA Attorney General's office reports that hotline tips have doubled. Tips related to suicide specifically have jumped from 17 to 37%. Those are your safe to say reports that we use across Pennsylvania. SAMHSA, through the Disaster Distress Helpline, has had a 338% increase in March calls compared to February 2020. But compared to March 2019, an 891%. The CDC director, Robert Redfield, warns that suicide and drug overdoses are killing more youth than COVID-19. And he says that resources to help combat these problems are overworked. And those of us working in the school systems may agree with that. Trainings I've been doing since March and COVID hit are on how to conduct virtual suicide risk assessments, because that's what we're doing. And our responsibility does not stop in schools because our kids are virtual. We still have that responsibility to do that. And the Addiction Policy Forum reports a 20% increase in substance use. The Trevor Project has done some research, and they found that 40% of LGBTQ youth seriously considered attempting suicide in the past 12 months, with more than half of transgender and non-binary youth having seriously considered suicide. And that's in the last 12 months. It was released in 2020, so we're not sure how the pandemic will also impact that. Again, COVID-19, I believe we are in a mental health crisis in this country. CDC did a survey. They found 10%, over 10% of respondents considered suicide in the last month. Over 25% of young adults between 18 and 24 have contemplated it in the last month. This is higher for Black and Hispanic respondents. 31% for unpaid caregivers and 22% for essential workers. 40% experienced a mental health or behavioral health condition connected to COVID. We are in a mental health crisis in our country. 31% report depression or anxiety, 26% report trauma and stress-related disorder because of the pandemic. We're not getting into trauma here, but when I do another presentation about re-entering back into schools and social emotional learning, I talk a lot about trauma and how that impacts. And I know that Steve and everybody from PDE and Patan have been doing a lot of talks on reentry and trauma, because it is a significant concern. And again, 13% have turned to substance use, and that's very concerning. And that's a recent study that was just published in August. Our kids, many of them are in toxic and challenging home environments. They are stressed. Our families are stressed. We have concern over increased child abuse. However, child abuse reports are decreased because school staff are often the ones reporting them. There's concern over our kids witnessing domestic violence. When I train our teachers, I talk about the fact that if you are virtual, make sure you talk to your kids about using the chat features. Make sure they know how to chat you privately. Practice it. When you get back from a break, have the kids all say, "Hello, I'm back," or "Good morning," privately chatting with the teacher, with the school counselor, with the school social worker, or school psychologist, to make sure the kids all know how to do it. And let them know if there's anything that's hard to say, virtually, or hard to say when we're talking in person. Here's a benefit of being virtual. You can chat it to me. So anything that's hard to put to words, go for it. We don't know about the trauma experience. We don't know a lot of times about our kids, and if they maybe lost someone close to them. Maybe we'll know if it's an immediate family member, but maybe if it's not immediate, we don't even know. Maybe we don't know about the secondary losses they're experiencing, like the parental financial losses. Maybe they've had to move. Maybe there's marital strain or separation. We don't know what our kids are going through. The Society for the Prevention of Teen Suicide said they have concern related to virus-induced chronic stress, where we're always just afraid of the virus. I can understand that. However, we also, again, on that positive side, some youth are thriving during this. We know that some youth struggled in school, maybe socially, and now learning from home virtually, they're thriving. Some kids, have this opportunity to spend more time with families. Some don't. Again, there's not equity there. Some are finding time to learn new hobbies and skills. But really, if we talk about Maslow, many of us are just trying to survive. And we have to realize there's not equity there either. And if we survive this pandemic, then that's just a win for all of us. Just in terms of the trauma, again, we don't know, but we do know, we're all familiar with the ACEs study, right? Adverse childhood experiences. But what I want to point out here is, if you've experienced trauma as a youth, you are 12 times more likely to make a suicide attempt. And that is so important here as we're looking at the unknown research and the unknown trauma related to COVID-19. So what are potential barriers to seeking treatment? Well, we know that there's age-related racial disparity in suicide rates among youth. Again, pre-pandemic. Children aged 5 to 12 years, Black children of this, and that should be capitalized, I apologize, should had a significantly higher incidence of suicide than their white counterparts. The suicide rate among those younger than 13 is approximately 2 times higher for Black children compared to white children. And this is observed in both boys and girls. Again, no research related to COVID yet, but the CDC does report an overrepresentation of Blacks among hospitalized patients. We know that among deaths, New York City found the death rates to be higher among Black or African American persons and Hispanic or Latino persons. That was higher than white or Asian persons. We know the health difference between racial and ethnic groups are often due to economic and social conditions that are more common. In public health emergencies, these conditions can also isolate people from the resources they need to prepare for and respond to the outbreaks, again, including this current pandemic. This current pandemic, we know that members of racial and ethnic minorities may be more likely to live, and this is right from the CDC, in densely populated areas, further from grocery stores and medical facilities. There might be multi-generational households, which might be more common for racial and ethnic minority families, making it harder to protect themselves against COVID, especially for older family members or those who have health issues that make COVID make them more at risk for COVID. We know that racial and ethnic minority groups are overrepresented in prisons and detention centers. And here in Delaware County, we did have an outbreak in our prison. The risk of infection are greater for workers in essential industries. And nearly a quarter of employed Hispanic and Black or African American workers, again, I apologize, no capitalization, are employed in service industry jobs compared to 16% of non-Hispanic whites. Hispanic workers account for 17% of total employment, but 53% of agricultural workers. Black or African Americans make up 12% of all employed workers, but 30% of those in practical or licensed vocational nurses. So basically, these are essential workers and less ability to protect themselves and stay home, less likely to have paid sick leave. So there's more concern with exposing themselves and exposing family members. There's also health disparities and lower access to care, not having health insurance, having serious underlying medical conditions. There's also stigma and systemic inequality. So what do we do? Well, a lot of times with our kids, we know that the, little things we do can make the biggest difference for our students. Be open. Let them know you're willing to talk about it. Let them know they're not alone. You are there to help, but get them help. And know your school district procedures for referral. So if suicide risk comes across virtually when a teacher's teaching, in person if you're hybrid, how do they get the referral to the school mental health staff? How does the mental health staff conduct an assessment? How do we make referrals if we find that suicide risk is very concerning? Make sure we know. In terms of looking at the pandemic, talk to kids. Regardless of your role, ask about them, the impacts of the pandemic on them. Ask who they live with. How's it going? How are they coping? What activities are they engaging in? How do they feel about returning to school or being virtual? Do they ever feel hopeless? Ask about suicidal thoughts. Ask how they feel they're doing academically. Ask what supports they have with the academics. Ask how they feel about the social distancing. And do they feel isolated? Open the door to communication. If you're in a school district, talk to parents. encourage parents to open up those conversations. Ask about hopelessness. Again, when, I mentioned that under the general questions, but pay attention. When kids say things like, oh, I'm so tired of COVID. Well, we're all a little tired of COVID, right? But what does that mean to them? Is it, yeah, we're all a little tired of this? Or is it, I am so tired of this. I don't want to live anymore. And so don't just take it for granted. Don't assume that that's what they mean, that we're all tired. Ask, what does that mean to you? Oh, things are just never going to be the same. Well, things might not ever be the same. Ask the student, what does that mean to you? So we have an understanding if, again, it's that whole thing we're all feeling, or if it's a little more, and again, they don't want to be here anymore in this new world. And consider access to means, especially if you're a school mental health professional. Ask about access to means. I think we always do this. But again, Thomas Joyner, right? You have to have capability, and having access to means can increase that acquired capability. We know that in general, CDC reports that more than 50% of suicide deaths are by firearm. And the resource I have here says the reduction of firearms is needed to save the lives of those considering suicide. However, March 2020, once the pandemic hit, was the second busiest month for gun sales ever. And that is concerning with suicide risk. We always must involve our parents. When I talk about suicide risk assessment in general, even more so during COVID, we have legal cases in our book, Suicide in Schools, where we talk about the importance of parental contact. It's the #1 legal and ethical complaint, and the #1 thing that a school could get founded on. So we have to be really careful. More than ever, interview parents. Whenever you're talking to a child, before you even are talking about suicide risk, we encourage you, talk to parents. If you just have a counseling relationship, if you are engaging in psychoeducational evaluations, ask about the impact of the pandemic. And on my website, erbacherconsulting.com, it's all free domain. Download it if it would be helpful. We have some parent interview questions. These are the topics we talk about to make sure we're not going to know about all the trauma kids have experienced during COVID unless we ask about it. And I really encourage you to do so. And then most importantly, this is stressful for us. This is big. We are in the middle of this global pandemic ourselves, regardless of our role. And even the stress management clinic has to be closed for stress sometimes, right? We have to take care of ourselves. We actually have an ethical responsibility to do so, right? Take breaks from work. If you're working virtually, it's so easy for the boundaries to get so lost. I encourage school mental health professionals, to put your hours, on your email, so that after hours, there's not this expectation now that we're in a virtual world that you are responding 24/7. It's not fair to you, and you will get burnout. If you do start to feel burnout, get that supervision and support for yourself. Consult with your colleagues, your peers, your supervisors. Make sure you do that. Take the time away from your computer when you're not actively working. And as always, in terms of we need to seek therapeutic support for ourselves as well if needed. Build our mental reserves during this time, right? And that includes things like regular sleep. I actually do a self-care plan for myself at the beginning of every year, and that does include good sleep. I have to admit, during the pandemic, that one's a little harder. I'm setting the hours aside, but it's hard. So I'm making sure to eat well, to exercise, actually taking more vitamins than ever. But I do get outdoors every single day that I can, unless it's raining, and build in that self-compassion we talked about. But know what self-care means to you. For me, it is being outside with my daughter, going on a hike, kayaking, just sitting in nature sometimes to eat, have a picnic. That is my self-care as a nature girl. The other one that's so important for me that I recommend is limit your readings that are stressful, right? It's easy to be on social media for us more often. I tend to go on in the morning. If I go on social media at nighttime, it just makes me that more stressed and heightened. Cortisol is going, and it's that much harder to fall asleep. So for me, I have to set the time of day. I want to know the facts too. I get my facts from CDC, the World Health Organization, So I know it's, more likely to be accurate, but there's so much floating out there that just creates stress that's not accurate. So be real careful and mindful of what you do.
I really want to thank Dr. Erbacher for all the helpful information she had provided for us to really understand the full scope as far as suicide risk and contextualize that with trauma-related experiences as well, and some of the essential things that we can do as school-based mental health professionals to care for our students and care for ourselves. Just as someone who I think really, I think of myself as a techie kind of guy, I really appreciated her feedback as far as really engaging students in the chat. Not only is it a powerful teaching and learning tool, but I never realized it could be such a safety tool. Tina, what stuck out to you?
So I think a lot of what she talks about that sticks out for me is just recognizing how the theme of equity runs through it all. That we have to keep in mind that not only do all students have difficulty accessing the mental health supports they need, but that it's actually even more difficult for some of our students. And that speaks to the systemic racism and inequities that have persisted in our society. And it seems like such a big idea, and how do we address that in schools? And I think that it really just starts with our own awareness, our own use of language, being willing to not be the bystander, to be willing to speak out at team meetings. If we feel like we're looking at all these referrals and we're recognizing an unfortunate theme through this, are we referring all of the same type of student? And can we speak openly about why that might be happening? So I think that especially with the idea of trauma and exactly what Dr. Erbacher talked about with housing, with multi-generational households, I often tell families, look, I'm Italian. Like my family would have me live in the same house forever if I would allow it. But we have multi-generational households very commonly in our culture. My grandmother lives with my mother, my father, and my mother frequently watches my nephew. My boys are old enough to be on their own, but she would have done that as well. So really just being aware of those family dynamics and how COVID has impacted how families are caring for each other, and then also how that impacts our students as they come to school.
Yeah, and I think just kind of pivoting off of that as we wind down, like we understand the language to be clear. Like in the clinical world, we talk about, again, different traumas, compounded traumas, whether it be directly COVID related, racial injustice, or any of these number of experiences. But like when we talk about social justice language, we understand there's another term for that, and that is intersectionality. We understand that our students, through systemic oppression, whether it be through race, gender, nationality, sometimes they'll have multiple lived experiences that can have compounding effects as well. I think, again, as our role as whether it be school psychologists or school counselors, be aware of the historic and systemic issues that our students face, taking time to engage with them as far as their lived experience, both through COVID and before, and understanding that, and then use that narrative to make and design intentional supports and resources for them and advocate for a better educational system on their behalf. I think this is really how our partnership can continue to work. Amelia, anything as we wind down you want to shout out as far as some of the upcoming opportunities that we have coming?
Yes, absolutely. Thanks, Steve. First of all, I want to thank both of you, Tina, Steve, for being here today and sharing all of this information. There is so much there, and it was so very helpful. I want to thank Terri as well for sharing her information with us virtually. As you guys saw in the chat, there are many resources there, and we will make those available to you after this webinar. If you, again, go to that website, paschoolcounselor.org/reentry, a recording of this webinar, as well as all of those resources that were posted in the chat, will be there as well. And make sure that you check out Terri's website, erbacherconsulting.com. That's also in the chat. A lot of those resources she talked about in her PowerPoint are right there on the website that you can just download and use immediately. Steve mentioned there will be a handout he put in the chat, so we will have that for you as well, and all of the other resources as I mentioned. So at the end of Terri's PowerPoint, which we are going to ask her for as well so that we can post that for you guys, she mentioned counselor self-care. So I wanted to make sure that I shared with you our upcoming counselor symposium that is going to be given in conjunction with PDE. And because that one is going to be completely focused on counselor self-care. That is going to be on Tuesday, September 22nd from 8:30 until 10:30 in the morning. Again, we hope that you can join us for that one. And if you can't, we plan to record that one as well. And again, everything is going to be on that website, paschoolcounselor.org/reentry. So thank you all for joining us today, and for, again, to our speakers for sharing all this great information with us. We hope that you found this useful and that you will check out the PSCA reentry guide that all of this webinar series is based on. So thank you all for being with us today, and we will see you again in 2 weeks for our next webinar. Take care.